Alright, so this model is pretty big and it shows several things. The main view that we're looking at here is we're able to see the spinal cord from the longitudinal and anterior view. So the bodies of the vertebrae have been removed throughout the length of the spinal cord. So with the spinal cord, from this perspective, you can see our anterior median fissure running the length of the spinal cord. And we can also start to see as these anterior roots, so here's some anterior roots coming off, they're forming the spinal nerves, which are a little bit masked here, and you don't have to worry about this. So those spinal nerves are relatively short, and then they form our anterior and posterior primary rami. Those anterior and posterior primary rami then go on to form the major peripheral nerves in the body. Sometimes those nerves, before they go out to form individual nerves, maybe one that's going down the lateral side of your arm, like the radial nerve, form different plexes. And basically what a plexus is a network of nerves. So they may come off of the ventral rami and merge together and then come apart again before they form their terminal branches. It's a little confusing and we're not going that in depth. Basically, for Bio 240, I want you to understand the basic four plexuses and where you can find them. So the first plexus that you're going to look for is called the cervical plexus. And there are several important nerves that come off of there, but the main one I want you to be aware of is this one. This one's called the phrenic nerve, and it goes all the way down to the diaphragm, which is one of your major muscles of respiration. If the phrenic nerve is damaged, we have a hard time breathing. So it's pretty important. And so with the cervical plexus, it arises from the ventral rami from cervical levels C1, 2, 3, 4, and 5. The next major plexus I want you to know, and if y'all are planning on going to med school, this one will be the bane of your existence. This one is called the brachial plexus because it's going down into the arm. It's quite complex. It's made up of ventral rami segments coming from cervical levels C5, 6, 7, and 8, and thoracic level 1. And there are several important nerves that come off of here. The ulnar, radial, median, and musculocutaneous nerves. So for us, we can see several of those from this model, but we're going to point those out on a different model in another video. So just hang on for that. So these represent the brachial plexuses. So let's work our way down this model, and we can see that the spinal cord ends at about vertebral level L2 in a little cone-shaped area called the conus medullaris, just where it ends. But the nerve roots that continue on collect in the vertebral canal and kind of look like a horse's tail. So we call this whole collection the cauda equina. Now coming off the tip of the conus medullaris, you have a little line of pia mater, because this is covered in pia mater, that helps to anchor the spinal cord in three-dimensional space. So we call this little filament the filium terminale. And it just acts as a little anchor point. We can also see from this view the other two plexuses that I want you to worry about. The lumbar plexus, which you can see at the lumbar level, and the sacral plexus, which is a little bit deeper here at the bottom. So the lumbar plexus comes from vertebral levels L1 through L4, and the major nerve that I want you to be aware of is the femoral. And it's going to follow our femoral artery and vein as well, going into the anterior thigh. From the sacral plexus, this comes from vertebral levels ventral rami L4 and L5, and then sacral levels S1 through S4. The major nerve that I want you to know here is known as the sciatic. So the sciatic nerve travels all the way down the posterior thigh and gives off branches that go down into the posterior lower leg and foot. And finally, before we sign off of this video, we can see where these plexuses are emerging. The spinal cord has a little bit of an enlarged area. So we have an area here called the lumbar enlargement and an area here called the cervical enlargement. It's just where these nerves are arising off. It bulbs out just a tiny little bit.